Welcome to Familycore, your favorite TV show that talks about everything around the family. We've been talking about COVID-19, and today we'll be talking to a professor of virology, a veteran in that field, about COVID-19 testing. After this break, I'll introduce my guest to you. Don't go away. Welcome to Familycore, your favorite TV show that talks about everything around the family.
Limiting your outings to those that are essentially important.
Practically brought the world to a halt.
Ames Media Company presents series on COVID-19 and the impact it has had on all spheres of our lives.
Everybody cannot be in the market at the same time.
It's not easy, but people have been coping.
A 1-week course on how to use Zoom, they go a long way rather than, can I hear you? Can I hear you? Can you guys hear me? Hello?
Familycore operates professors of medicine and other medical experts. Join our studio chat.
There are different types of diagnostic tests.
Mental health segments.
When there is a threat to health, the attendant effects of anxiety will not be far-fetched.
People speak.
Everything is literally expensive. I don't know if it's because of COVID.
Drama.
Hudson!
I talk I don't die.
What's happened? Person no fit sneeze again.
Hey, see, no be say you no fit sneeze, but there are protocols for sneezing in case you have COVID.
Familycore, enhancing a cohesive family and society.
Welcome back. Today, like I said, we'll be talking about COVID-19 testing, and I have in the house the director of Central Research Laboratory and a professor of virology at College of Medicine, University of Lagos, and president of Professor Omilabu. Prof, you're welcome to the show. I'm very excited to be here with you because there's a lot of things I would want you to answer so that we can learn more from this. What is COVID-19 testing about, sir?
Thank you very much. The COVID-19 testing is our ability to make a diagnosis of the causative agent of that disease. And the earlier we diagnose, the better for disease management and spreading. So we really need a very reliable testing diagnostics that will be very prompt because we know the agent can spread faster. So we've now seen that the agent of COVID-19, SARS-CoV-2, is airborne. And that's why we need to make diagnosis very early. And when you're talking of diagnosis, there are different types of diagnostic tests. There are those ones that actually uses nucleic acid. Nucleic acid, we mean we go into the inner core of the viral agent. And then, of course, we have another set of diagnostics that are called rapid diagnostic tests. These are antigen detection tests. It looks for the viral antigen in the sample. And then, of course, there are some that detects antibodies to the viral agent. So we have these various diagnostic tests, but the most reliable, according to WHO now, is the nucleic acid test using the PCR.
Does everybody have to take the test, or what would be your advice? Should it be that I have a complaint of sore throat or cough or fever before I present at the testing lab?
Yes. If you don't have clinical signs and symptoms, the chances of detecting the agent in that individual will be very, very remote. So it's always better to have people with clinical signs and symptoms so that the test can detect very fast. If an individual comes and we carried out the test and it comes out negative, so it means we're wasting the scarce resources, and then the individual might not even believe in us if we say, oh, sorry, it's negative. So that's why it's always good to have people that are clinically showing signs and symptoms. And that's why we always say, if people say we have contact with an individual who is tested positive.
If a family member of mine tested positive.
So we advise that, okay, fine, isolate yourself, be waiting for when you will be having
on the
watch out and be looking for those signs and symptoms. Because it's always better to show signs and symptoms before you come for test. So because we are really sure that within those period, we'll be able to pick some of the viral markers.
There was a time in the US they talked about the frequency of testing and the number of testing or community testing. Is there any need for community testing? Going to the community and picking up people?
Yes. What actually informed community testing, it's the upsurge in the number of cases being picked following the lab test.
Looking at the values that we see daily, is it a true representation of what may be in the community? People believe that those numbers are not true representation of what may be in the community.
Yes, the numbers may not be true representation, as said earlier. And that's why we need to go to the community.
If you have the resources,
be very close to them. And then call them out, house to house. Ask questions. How many of us have been having a fever in the last 24 hours, 48 hours? How many of us are coming here? So those are the kind of the questions that we ask, and then you now identify the likely cases, likely cases. And then you now take samples from them. And we really saw then that it really helped, because we were able to pick a number of cases.
I saw a video where the Lagos State governor talked about the fact that when the cases went up in January, that they're going to treat every case that comes like malaria as COVID. What would be your response to that with respect to maybe the facility? I don't know how much facility we have for that testing, to say every patient that presents with fever or signs and symptoms of malaria will be tested.
Yes, when you are talking of resources, we have resources to take care of all the tests, because the state government is actually trying in prepositioning reagents. And of course, the NCDC too is also prepositioning testing reagents at the Lagos University Teaching Hospital where we work. And then, of course, you are familiar with the Lagos State Biobank too, where they also carry out diagnostic testing there for the public. The same thing also is happening in NIMA, Nigerian Institute of Medical Research. So these are public health laboratories.
It's been Familycore, and today I'm talking to Professor Milabu on COVID-19 testing. After this break, we'll continue from here. Don't go away.
I feel everyone should do the test regardless, whether negative or positive, because everyone is supposed to have done the test because it's since last year. So it's very necessary.
Yes, it can be done. If there's any medicine to protect it, let government provide it for individual.
Welcome back to Familycore, and today I'm with Professor Milabu, and we're talking about COVID-19 testing. I was going to ask you, how cheap is this, or how affordable is this COVID-19 testing?
It's free in all the public health laboratories. All the tests is free.
How many test laboratories do we have in Lagos?
We have 4 that are public health laboratories.
And how does it work? Is it that I would have to call or book an appointment, or I'll just walk in?
Lagos State have centers where they collect samples.
Okay.
From all the 56 LGAs in Lagos State. So they have collection centers. So these samples come to LSB, Lagos State Biobank. And then, of course, we have Lagos University Teaching Hospital, where they attend to patients on daily basis, people with signs and symptoms. They attend to them on daily basis, and samples are collected. And these samples are brought to our lab, so where we do the analysis. At Nigerian Institute of Medical Research, they have an online booking, so which they use to recruit patients, since they don't have a hospital. So and then of course there's another lab, Lagos State University Hospital. There's another lab there. So we have all the labs there attending to public health issues. So once the patients come, and the doctors will see them, and then the samples will be taken. And then they will, take for example in Lut, so they will go to the A&E where samples are taken, and then from there they bring the samples to the lab. So we in the lab, we now process the samples, and then we release a result forthwith. And the results are released on a platform developed by NCDC as well as the Lagos State Biobank. So the results get to the platform, and all of us, we can see the results there, all that are linked to this platform.
Prof, you've really demystified COVID-19 testing, because the truth is, out there, we believe that it's tough to get tested. We believe we must get to those 4 centers. We don't know that we should go to some centers. Maybe we can go online and get, or how do we know those places where, or if I get to any general hospital, can I get tested?
Yes, they have, I said Lagos State organized collection centers.
Okay.
Some are within the hospitals. Federal Medical Center is one of the hospitals handling patient and COVID patients. So they take samples and so on. So they are so most of the hospitals in Lagos, they have sample collection centers, and then they now send all these samples to these labs. They send to us in the lab, and then we take care of it.
Okay, so we should feel confident to walk to those places.
Sure.
Also, people have the fear that as soon as they have any, they're afraid that even if it's just malaria and they say they have fever, they have cough, they will say it's COVID. What would you say to them to reassure them?
Actually, once we say we have malaria, we have cough, and sore throat, so we have to rule out the real cause. So, malaria could present like that. COVID-19 could also present like that. And so we know we are in the outbreak of COVID, so we need to rule out. If you say, okay, loss of taste, loss of smell, so all these, or breathing difficulties. So once they make such complaints, so we have to rule out that if it is not malaria, what then? So let's check for other pathogens that could, especially, and then now we have COVID-19. So that's why we have to actually target COVID-19. And since we have the laboratory that could do it, we have the reagents, so what stops us from doing that and then rule it out? Because we know that if you don't rule it out and we allow such an individual to now go back home, he will continue to spread the virus. And that's what we have to prevent. You don't want it to be spreading. So it's one of the measures that, okay, put on your face mask so that you don't spread it to other people around you. Maintain social distance. If you want to sneeze into your elbow. So those are measures to mitigate the spread. So, and if you don't rule out an individual, so the moment you rule it out, then you now advise the individual, please stay at home, isolate yourself, then you'll be taking your medication.
Okay, Prof. Now we are reassured that testing is easy and is free. we still know that some people are still paying for these tests. What do you have to say to these people? They really want to do the test, but they are paying for the test, or they are told to pay for the test, particularly students that are going to boarding school.
We have private laboratories.
Okay.
And they are licensed.
Test.
So they are the ones charging.
Okay.
For those that cannot come to the public health facilities. So we have a good number of the private labs in Lagos State, more than 15 now.
Wow.
So we have private labs to augment the public health laboratories, especially for those that want to check their status before they go to the school or before they even travel. So those ones are paying.
Okay.
But in the public health laboratories mentioned earlier on, it's free.
Free.
And doctors are there, people are there to collect samples. So we have collecting materials. They are there, so they don't have to even buy. So all the samples collected in the day, the results are released by the evening.
All the results in a day?
Yes, all the samples collected between hours of 9 and 11. So they bring to the lab.
So the daily reports we see, they are the tests of that day?
They are the tests of that day.
I know somebody who, a family friend who told me that she went for test and she was told to wait for the result, that they will contact her. If she's positive, they don't contact her, then she's negative. For 2 weeks, there was nothing. After a week, when she didn't get anything, she started moving around, but she was wearing a face mask. It was after like 3 weeks or 4 weeks, they called her that, you're positive. What do you have to say to that, Prof?
Yes, it happens a while when you have a mix-up. So number one, there are inadequate information following samples. So that's why we have to be very careful why we are taking samples. There must be adequate information to follow each sample. So where you don't have adequate information, and we advise that such samples should not even be processed, where you don't have enough information, because you need to really follow it up, whether it's negative, whether it's positive. So we really need to follow it up. So when you don't have information, so there's nothing you could do. So in our own lab, we don't even run such samples. We need the details, the
name of the
name, the age, the sex, the location, the time of collection, because we have to now use that one to judge how long the samples has been staying outside. Because the moment they collect the sample, they should not waste time. The sample should get to the lab that day. So they must fill a form for each sample and put a code on the container.
To link it.
To link it. So you now use the code. It's the code we are working with. So they now enter all the information from the form into the platform. So then we are now waiting for the lab result so that they will now add to it. But where you don't have samples with adequate information, so there will be confusion as to what do we report.
Okay, so in a situation where there's a time between the collection of sample and then the testing,
yes.
What happens if the machine breaks down?
So that one is internal.
Okay.
Once there is a breakdown in the machine, so the lab will now make efforts to contact other laboratories. So we quickly transfer some samples.
Okay, Prof. On a final note, quickly, last word for those listening.
Well, just to reassure them that we now have capacity to do the test. And of course, in all the public health labs in Lagos, the test is free.
Local government
Within all the local governments, they collect samples, and samples are brought to the laboratory.
centers.
Yes, and the results come out fast. In our own lab in Lut, that very day we have the results by the evening, and we release the results so that doctors can take action, manage cases. I call individuals, advise them. Those that don't have severe signs and symptoms, they can stay at home and manage it. They isolate themselves. Those that have complications, those ones are moved to the hospital.
All right, Prof. Thank you so much for this session, and we're hoping that if we call you again, you would, out of your tight schedule, we know you'd work it so hard to make sure that we all have, we all live healthy out of COVID-19. Thank you for coming, Prof.
It's my pleasure.
Yes, that has been Familycore. We've been talking about COVID-19 testing with Professor Omilabu. We have other segments, and I'm hoping that you enjoyed this so much, you learned so much from it, and then you would wait to enjoy the other segments. Don't go away.
What is new today?
Oh, so you've not heard? Gbege don shele. You did not hear that somebody in our neighbor's office has tested positive to COVID-19.
It's a lie. It can't be.
I know it can be. So, well, I thought to say it's a white man disease.
Yes.
MD has said each and everyone should go for the testing. He has even made arrangements for everybody to go and do the test. If you like, just check to know when it's your turn.
Okay, no problem. I'll go. There's no harm in knowing the status.
Hello, everyone. Testing for COVID-19 is also a major issue, and the impact on the mental health of individual is something worthy of discussing and addressing. In the sense that before you go for tests, I know a lot of people who deserve to go for this test, but they don't want to go for it because of the anxiety of what the outcome will be. And thank God that the level of awareness is so high now, and then people know that the fact that you test positive is not a death sentence. But despite that, the fear of people that have been exposed to them, perhaps the elderly ones, the younger ones whose immunities have not been tested, have not seen the light of the day, and then the people around them who have had other comorbidities. This has been a whole lot of concern. Some people are even saying that something you don't know may not likely kill you. The moment your ears hear the bad news may be a major issue. So this now leads us into the issue of pre-test counseling and post-test counseling. So this is very, very important. Before you go for the tests for COVID-19, which is a disease that is highly stigmatized, just like HIV. So you need to do pre-test counseling so that you know what you are likely going to see, what you should be expecting if the test comes out positive, and what may likely happen, the treatment modalities, if the test comes out positive. That is not a death sentence. In this sense, if the test comes out positive, there is what we call psychological first aid. This is the kind of treatment you get, just like normal first aid, medical first aid, is the kind of awareness, cognitive. When you're talking about cognitive, it has to do with thinking and behavioral awareness that people have when they have distressing situations around them. Distressing situation in the sense that when you are tested positive, is a lot of distress to you. It's a lot of distress to you, and it causes you so much anger. And this anger can lead to anxiety. Anxiety leading to, can even get worse and leading to depressive symptom, leading to depressive disorder. Even some people even have psychotic symptoms to the extent that they had to place them on antipsychotics. So in this sense, please, if you test positive, it's not a death sentence. It's not a death sentence. Seek help. Seek help from people that will be of utmost help unto you. Don't seek help from the wrong places. One of the places where you can seek for help is if you have someone that is a psychologist, you can see the person can talk to you about managing your anxiety level, about taking care of the depressive symptoms that you could have. Or you can also go to the extent of also seeing a psychiatrist. There is need for that, so that all grants will be covered. And at the end of the day, you know that if the test comes out negative or positive, it's still you are still the same person, and it may not change anything. The only thing that can change is you.
Welcome back to Familycore. We've been talking and doing a lot of things about COVID-19 testing. I'm very sure that you've taken a lot of lessons. Now you know that you can take your test free of charge. There's no need to be afraid. COVID-19 is real. Till next time when I come your way, please keep staying safe.